Welcome to Hit Show, your go-to source for today's leading healthcare business headlines. I'm your host, Rhonda Brooks. It's Wednesday, August 27th. Today on Hit Show, Johns Hopkins steps out of UnitedHealthcare's network, and the physician shortage shows no signs of easing. We'll also look at new American Heart Association pilots, from produced prescriptions to at-home monitoring. After the break, mPulse makes an acquisition to expand its health experience footprint. A Mayo Clinic leader jumps into venture, and we'll close with something light. Let's get started. We begin with a high-stakes contract dispute in Maryland. Teresa Vaughn has the details.
Johns Hopkins Medicine has officially exited UnitedHealthcare's network after negotiations broke down. What's striking is that the disagreement wasn't primarily about payment amounts. Hopkins leaders say their main concern was UnitedHealthcare's prior authorization practices. They argue those requirements were causing delays in patient care and heavy administrative burdens for clinicians. UnitedHealthcare defends prior authorization as a safeguard against unnecessary costs, but the issue was enough to end the agreement. The impact is significant. The termination affects Johns Hopkins Hospital in Baltimore, its regional hospitals, and affiliated clinics across Maryland, leaving thousands of patients either facing out-of-network costs or searching for new providers.
So, Teresa, what does this mean for other providers watching the situation?
It could set a precedent, Rhonda. If an institution as large and respected as Johns Hopkins is willing to walk away over prior authorization, other health systems may feel emboldened to demand changes too. Analysts say the dispute shows how contract negotiations are shifting from pure dollar amounts to how insurers control and manage access to care.
And that shift could redefine payer-provider relationships far beyond Maryland. Thanks, Teresa. And alongside payer disputes, the bigger workforce picture continues to raise alarms. Logan Stokes has that story.
A new report from the AAMC shows a shortage of up to 86,000 physicians by 2036. The report highlights three drivers: a wave of retirements as nearly half of current physicians approach age 65, an expanding and aging population that requires more care, and training pipeline bottlenecks that prevent enough new doctors from entering the workforce. AMC leaders say that without significant changes, such as expanding medical school slots, increasing residency funding, and exploring team-based care models, shortages could worsen access to both primary and specialty care.
Those are sobering numbers, Logan, and a reminder that access challenges aren't just about contracts, but also about capacity.
Exactly. Payer disputes can shift month to month, but the physician shortage is a structural challenge that will persist unless policy changes are made.
Thank you, Logan. Next up is innovation in heart health. Jade Romero is covering two new American Heart Association pilots.
That's right, Rhonda. The American Heart Association is launching two groundbreaking initiatives that tackle cardiovascular health from different angles, one addressing food access and the other focusing on remote monitoring. The first is the GoFresh Southeast trial, a partnership between Rimidi, Beth Israel Deaconess Medical Center, and the American Heart Association. This food as medicine study gives patients actual prescriptions for fresh produce to improve diet and address the risk factors of chronic disease. I spoke to Lee Shapiro, chairperson of the American Heart Association.
The American Heart Association's Health by Food initiative is advancing food as medicine interventions in healthcare by building scientific and real-world evidence for prescribing healthy food to treat, manage, and prevent chronic disease.
The program is part of a much larger research effort. The AHA is funding 23 different studies to build the evidence base for food as medicine programs.
Through our 23 funded scientific studies, including the GoFresh Southeast trial, and the involvement of community organizations, companies, providers, and advocates nationwide, we are building the case for clinically and cost-effective food as medicine programs to be covered by health insurance.
I also spoke with Lucienne Eade, CEO of Rimidi, about their role in the Southeast trial. Her company will be tracking how food deliveries impact patients' blood pressure readings.
We are so excited to be part of this initiative and study to be able to measure the impact on blood pressure of delivering healthy groceries to patients at home. And the fact that it's in the Southeast where we're based makes it even more exciting and impactful for the Rimidi team.
EAD says the measurement process will track changes before, during, and after the dietary intervention.
So in this study, Rimidi will be facilitating measuring patients' blood pressure at home on a daily basis before they start the dietary intervention, and then remeasuring their blood pressure over the week after completing the intervention of having healthy groceries delivered to the home.
The second project is an at-home monitoring pilot launched by the American Heart Association and Cadence, giving hospitals a framework for remote patient monitoring of cardiovascular conditions.
Jade, this feels like two sides of the same coin, addressing both social drivers of health and clinical monitoring.
Exactly. The AHA is recognizing that heart health requires both addressing social determinants like food access and leveraging technology for ongoing clinical management.
Thanks, Jade. From payer contracts and workforce shortages to new pilots in heart health, access and innovation are reshaping care delivery. But after the break, we'll turn to the business side. From acquisitions that are redefining patient experience to leadership moves that could shape the next generation of health tech. Stay with us.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care, their way. The journey toward the summit of healthcare has begun, and through partnerships built on trust, Sunrise is helping healthcare organizations bring next-level care within reach.
You're listening to HITshow. Now to digital health M&A, where mPulse is expanding its member engagement platform. Peter Betterworth has the story.
mPulse has acquired Clarity Software Solutions in a move to create what the company calls a unified end-to-end experience for health plan members. The deal brings together mPulse's health experience and insights platform with Clarity's member communication and engagement solutions.
As healthcare consumers demand for more digital-first tools and solutions to navigate their healthcare journey, this strategic transaction, unites two leaders for a unified end-to-end experience across channels that magnifies the value for health plans and their members. The combination of mPulse's advanced health experience and insights platform, HXI, and Clarity's robust member communication and engagement solutions will solve healthcare's complexities to help improve plans to overcome performance gaps, improve health outcomes, and provide operational efficiencies.
CEO Bob Farrell says this marks mPulse's fifth acquisition since he joined the company, part of a strategy to build scale while driving organic growth. With the Clarity deal, mPulse will grow to about 760 employees and now serves over 400 healthcare organizations.
Peter, this seems to fit the broader trend of companies consolidating digital health tools under one platform.
Exactly. Rather than health plans juggling multiple vendors for member engagement, companies like mPulse are betting on integrated solutions that can handle everything from communication to data insights in one place.
Integration as a competitive advantage. Thanks, Peter. In leadership news, another familiar name is stepping into the venture space. Anika Shah reports.
Chris Ross, longtime CIO of Mayo Clinic, is joining Aegis Ventures as a partner. He's expected to help co-build new health technology companies, drawing on his experience guiding Mayo through digital transformation. At Aegis, Ross will focus on investments in AI-driven clinical tools, digital infrastructure for health systems, and solutions that reduce provider administrative burden, areas where his background at Mayo gives him deep insight. It's part of a broader trend of seasoned provider executives moving into venture-backed roles, shaping startups with practical health system expertise.
A sign that venture firms are betting on leaders who've lived provider challenges firsthand and know where the opportunities really lie. And finally, today is National Just Because Day.
That's right, Rhonda. It's the one day a year where you don't need a reason to do something out of the ordinary. Call an old friend, eat dessert for breakfast, or, if you're really bold, don't answer your emails just because.
Careful, Nate, if our listeners stop checking emails just because half the health IT world might grind to a halt.
True. Though some of them might argue that wouldn't be the worst thing.
Fair point. However you celebrate, do something today just because and maybe keep the servers running while you're at it. That's all the time we have for today. Thank you for joining us on Hit Show. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on hit.show. Hit Show, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. Hit Show is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, kimchi.com.